Brain hemorrhage is a type of stroke in humans. It is caused by an artery bursting in the brain and causing localized bleeding in the surrounding tissues. The bleeding caused by it can kill brain cells. It is also called cerebral hemorrhage, intracranial hemorrhage, or intracerebral hemorrhages. Brain hemorrhage accounts for about 13% of all strokes. What happens in brain hemorrhage? When blood from trauma irritates brain tissues, it causes swelling. This is known as cerebral edema. The pooled blood collects into a mass known as hematoma. These conditions increase pressure on nearby brain tissues. This condition leads to reduced vital blood flow, which kills brain cells. Bleeding can occur inside the brain, between the brain and the membranes that cover it, between layers of brains covering, or between skull and the covering of the brain. What causes bleeding in the brain? There are several causes of brain hemorrhage. The most common ones include head trauma, high blood pressure, aneurysm, blood vessel abnormalities, amyloid angiopathy, blood or bleeding disorders, liver disease, brain tumors. What are symptoms of brain bleeding? The symptoms of a brain hemorrhage can vary. It depends on the location and severity of the bleeding and the amount of tissue affected. The symptoms include a sudden severe headache, seizures with no previous history of seizures, decreased alertness, changes in vision, difficulty speaking or understanding speech, difficulty swallowing, loss of fine motor skills such as hand tremors, loss of coordination, an abnormal sense of taste, loss of consciousness. Keep in mind that many of above symptoms are often caused by conditions other than brain hemorrhages also. How is a brain hemorrhage treated? Once you see a doctor, they can find out which part of the brain is affected based on the symptoms. Doctors may run a variety of imaging tests such as a CT scan or MRI, which can reveal internal bleeding or blood accumulation. A neurological exam or eye exam may also be performed. Treatment differs depending upon cause and extent of hemorrhage. Surgery may be needed in few cases to prevent bleeding. Medications are also prescribed such as painkillers, corticosteroids to reduce swelling and to control seizures.